Right. Welcome, everyone. Thank you all for joining us today to talk about the highlights from our State of Global Air 2025 report. My name is Helena Quiros, and I'm a research assistant at the Health Effects Institute, working with the State of Global Air project. We have an exciting group of speakers today that will share a bit about the findings of the report and the key points from today's edition of the SOGA 25 report. And before we get started, just a couple of housekeeping items. Please submit any questions via the Q&A function. You can also upvote questions from others. Following today's live session, the webinar will be recorded, so all the slides and the recording will be available on the SOGA website next week. And before we get started and meet our panelists in the session, I first want to share a bit about HEI and the State of Global Air project. So about the Health Effects Institute, HEI is a nonprofit corporation with a mission to provide impartial science to inform decisions that foster a healthier environment for all. Through our three programs, or we achieve this through our three programs, the Environment and Health, Energy, and Global Initiatives teams. HEI then delivers complementary research and insights to inform public health solutions. And then about the State of Global Air project, which is one of the projects under the Global Initiatives team. We track and communicate long-term trends in air quality levels and health impacts for cities and countries around the world. It's a collaboration project between the Health Effects Institute and the Institute for Health Metrics and Evaluation. And it's a very great resource for global estimates, allowing a start point for understanding the scale of the health impacts of air pollution. And along with the State of Global Air project and report, we also offer data and resources on our website through our interactive data app and through our fact sheets and infographics, interactive figures. You can toggle and play around with different data points by pollutant type, by region. You can also compare on national and regional and city levels, excuse me. We also have data available on our website from 1990 to 2023. Alongside this, we also have our monthly Science on the 7th series where we talk with guest speakers about various topics surrounding air pollution and exposure and health impacts. We also offer on our YouTube and website videos on the health impacts of air pollution. We also offer resources in a variety of languages. And of course, if there's ever any request for a certain resource in a particular language, you can always contact us. Our contact information will be available at the end of the presentation today. And so today we have a great set of speakers that will offer different perspectives as well as the findings from our annual report. So now I'm going to pass it on to HEI's Head of Global Initiatives, Dr. Pallavi Pant, who will share more about the findings from this year's report. And as mentioned earlier, please ask questions using the Q&A function. And Pallavi, I'll pass it on to you.
Thank you very much, Helena, and welcome everyone. We're really glad you're here with us today to talk a little bit about the latest data on air quality and health impacts, and also hear from our very excellent panelists who are going to be joining us shortly. So just to get us going, starting with the big numbers, I think these may not be very surprising for most of you, especially if you're working in this space for a while. The biggest number, about 8 million deaths, resulting from air pollution exposures worldwide in 2023. This air pollution being a risk factor that now ranks higher than some of the more traditional risk factors that we tend to be more familiar with, like diet or physical activity, and continuing to have significant impacts in most parts of the world, but especially in low and middle income countries where the exposures tend to be high and as a result, the health impacts are equally high. This year's report, if you've already taken a look at it, is focusing on non-communicable diseases. These are chronic diseases that tend to develop over a long period of time, but also last for a very long period of time, or having a whole variety of impacts. And what we are seeing is that about 86% of all air pollution deaths were as a result of non-communicable diseases. And what do we mean by non-communicable diseases? Which diseases are we referring to? This includes things like heart disease, chronic respiratory diseases, lung cancer, diabetes, and for the first time this year, estimates on dementia, which is a neurodegenerative disease typically seen in older adults. And the other part, which is also really critical, is that a majority of the deaths happen in older adults. We saw of the roughly 8 million deaths, about 6 million from in adults over the ages of 60. And this is critical because around the world, we're seeing population trends changing, with more countries starting to experience that shift from younger populations to older populations. And what this means is that if there's the strong connection between air pollution and non-communicable diseases, and as people are getting older in many parts of the world, we may see an increase in the air pollution disease burden over time. So it's really critical for us to be thinking about how we can tackle the issue of air quality, how can we improve air quality so that we can both manage the burden now, so ensure that we are not, increasing this burden incrementally over time. So just to set the scene a little bit, around the world, we've seen a number of studies looking at health effects of air pollution that tell us how exposure to air pollution results in health effects. And based on that, the World Health Organization in 2021 updated their recommendations for what they said should be reasonable targets to move towards healthy and clean air for all. The guideline for PM 2.5 or fine particulate matter, for instance, was set at 5 micrograms per meter cube, but there's a successive series of interim targets starting at 35 micrograms and going to 10 micrograms per meter cube, essentially offering countries a pathway and a set of milestones to progressively improve air quality. What we saw in 2023 was that about 36% of the world's population, so people around the world, but predominantly in regions including Africa, Asia, and Latin America, also some parts of Europe, especially Southeastern and Eastern Europe, people are still experiencing air quality or levels of PM 2.5 that are higher than even the least stringent interim target that the WHO has recommended, about 35 micrograms per meter cube. Couple this with the fact that many countries still do not have air quality standards at the national level. These are often, regulatory standards which have to be met. We see that a significant proportion of the world's population is still breathing air that is of poor quality. On the other side, we see increases in levels of pollutants such as ozone. Ozone is a secondary pollutant, which means it is not emitted in the air directly. It is formed in the atmosphere through chemical reactions, in the presence of sunlight, and through other pollutants like nitrogen oxides and volatile organic compounds. And in the last decade, we have seen a very rapid increase in levels of ozone, especially in South Asia, in parts of Africa and West Asia as well. And even in places like the US, the levels of ozone still tend to be pretty high. So the trends, as you might expect, for PM 2.5 are different from the trends that we see for ozone, especially when we look at the geographic variability, which countries are experiencing increases. And ozone is also a greenhouse gas, as you may know, and a super pollutant, meaning that it has climate warming capabilities. So it's really critical for us to be thinking about what it means to have these really high exposures to ozone and increasing with time. Just in the last couple of years, depending on what part of the world you live in, you may have experienced an ozone episode during an extreme heat event. So there's clearly a link also between how our climate is changing and how that might trigger increases in certain pollutants. And similar to PM 2.5, we see that about 40% of the world's population is currently living in areas where the levels of ozone do not meet even the least stringent criteria that the WHO has recommended based on decades of health evidence. If we move now to the health effects, I'm really trying to give you a quick flavor of the key messages. So I'm not going to go into detail on every single message or data point in the report, But as we have said in previous State of Global Air reports, air pollution really has the largest impacts in children, young children, starting from infancy to children during their development phase up to the ages of 5 years, and then in older adults. What that means practically is in 2023, just to set the context, non-communicable diseases, so again, think about cardiovascular diseases, respiratory diseases, diabetes, cancers, they were among the top 10 leading causes of death. So this is what is, causing people to die. When it comes to air pollution, 9 out of 10 air pollution deaths worldwide were because of non-communicable diseases. And this number changes a lot if we look at different countries. So the total number may be different for a country like the US compared to a country like Nigeria, but at the global scale, this really means that a very significant proportion of deaths are non-communicable disease deaths are coming from exposure to air pollution. 1 out of every 2 COPD deaths. COPD, as some of you may know, is a chronic respiratory disease. It is not a disease that can be, cured. It can be managed through medication and other efforts, but you cannot cure the disease. And globally, 1 of every 2 COPD deaths is as a result of exposure to air pollution, either household air pollution or outdoor air pollution. 1 out of every 4 ischemic heart disease deaths is linked to air pollution. Stroke, similar story. Diabetes, 1 of every 6 deaths at the global scale. When we start to look at some of the regional patterns here in countries like India, where diabetes tends to be more common, we see that number go up to 1 in 4 or 1 in 5. So air pollution clearly is a risk factor that is making a significant contribution to the non-communicable disease burden. And I think it is really important for us to be thinking about how we can integrate air pollution into NCD prevention and management. How do we talk about that in a better way, in a more effective way? And hopefully we're also going to hear from Rachel from the NCD Alliance a little bit later on, more on this. As I mentioned earlier, this is the first time that we are presenting data on neurodegenerative diseases, in particular dementia. And again, a very alarming statistic. Globally, 1 out of 4 dementia deaths were due to exposure to air pollution. Very interesting patterns around the world. This map here is giving age standardized death rates due to dementia, which is linked to air pollution exposure. And why I say age standardized death rates is because often, as you know, countries are of very different sizes. So population of India, over 1 billion people in the country, compared to another country that may be 3 million people, 5 million people, 50 million people. And if we want to look at how these countries compare with each other, age standardization offers us an opportunity to do that, so we can compare them on a more even keel. So if we look at the global trend of dementia deaths that are attributable to air pollution, again, we see similar places in the world, showing those higher impacts, parts of Africa, parts of Europe, parts of Asia as well, and then Latin America. And overall, at the global scale, we saw over 500,000 deaths, about 626,000 deaths worldwide. And critically important, there has been an increase in this number by about 100% in the last 2 decades. And remember, I said at the very beginning that many countries around the world are experiencing aging populations. There's starting to be more older people slowly in some countries and very rapidly in others. There's starting to be more older people. And as we think about some of these NCDs, especially things like dementia, this is a problem that we really see in older adults. And that's a very, very big number. And the contribution that air pollution is making to the overall dementia burden. There's about 60 million cases worldwide of dementia. That number is also going up. So pretty stark data here, and something for us to consider on how we can use this information to really trigger action. Children's health is another really critical part, often, of how countries want to think about their policy making. And similar to previous years, we see that air pollution is the second leading risk factor for deaths in children under 5, right after malnutrition. And in many cases, if we start to look at other risk factors, we see that over the last 2 or 3 decades, there have been massive improvements in other environmental risk factors like water, sanitation, and hygiene. We've seen that the number of deaths dropped significantly in the last 2 or 3 decades, whereas for air pollution, we're still seeing that it's ranks really high. And in some places, especially in Africa and in parts of Asia, we see exposure to air pollution making a really big contribution to the overall disease burden in children. Over 6 million healthy years of life lost. And even in newborns, within the first month of life, we see about 26%, so more than 1 in 4 deaths that happen in children or in infants within the first month of life being as a result of exposure to air pollution, largely during pregnancy. So this is before the child is even born. More than 500,000 deaths again in children under 5, and primarily this is happening in Asia and in Africa. That's where we see the biggest impacts. And I keep saying Asia and Africa consistently. So let's look at some of these numbers. There are very significant disparities, both when we look at exposures and especially when we look at health impacts across the regions around the world. The death rates tend to be anywhere between 5 to 10 times higher in low and middle income countries compared to higher income countries. And just to look at one part of Asia now, South Asia, which is also one of the most populated regions in the world, more than 2.5 million deaths happened in 2023 as a result of air pollution exposure in that one part of Asia. In Africa, we saw over 1 million deaths as a result of air pollution exposure. And I also want to take just a minute to talk about the figure that you see on the screen here. This is essentially trying to map out what percentage of the population is exposed to household air pollution, because that's another really critical contributor to the disease burden worldwide, but very narrowly focused in certain regions of the world. It is not a problem everywhere. Ambient air pollution is an issue everywhere, but household air pollution tends to be really focused in certain regions, and it plots the percentage of population exposed to household air pollution with the socio-demographic index, how countries are developing and where they are in that process. So how much access to healthcare do they have? What are the education levels? Combine all that information to come up with this index. And what we see is that primarily countries in Africa, countries in South Asia, some countries in Central Asia tend to see the biggest contributions from household air pollution and are also at earlier stages in their development cycle. This can be a scary statistic or a scary piece of information, but it's also a moment where we can take this opportunity to try and think about cleaner pathways towards progress, towards development, towards better security, better well-being, by thinking about how to address air pollution. And one of the success stories that actually deserves to be talked about a little bit is that we have seen at the global scale a steep reduction in the burden due to household air pollution exposures. This has happened over time through very significant efforts that countries have made to provide access to clean energy and clean cooking solutions to people, so that they're able to switch from the polluting fuels like wood, coal, charcoal, animal dung to other cleaner energy sources. Yet, despite these steep reductions in parts of Africa, especially, and also in some countries in Asia, we see that the burden of disease is still pretty high. In several countries across Africa, we see that over 90% of the country's population is still relying on solid fuels for cooking. And as much as we can celebrate globally the reduction in the burden of disease due to household air pollution, I think moving forward, we really need to keep this issue of household air pollution front and center if we are trying to think about the areas with the largest burdens of disease. And also the issue around household air pollution links with the issue of energy access. Several sustainable development goals and targets are aimed towards trying to improve access to clean energy and access to energy in general. This is also an area where, societally, we all aspire to have access to clean cooking solutions. That's the better way of cooking. That's the better way of doing things. So in thinking about addressing air pollution, let's not forget the regions where we still need to be thinking of household air pollution as a critical contributor to the burden of disease and also to outdoor air pollution in some cases. According to one estimate, globally, about 20% of the outdoor PM 2.5 levels that we observe are as a result of cooking with solid fuels in homes. I know that was a question that someone had asked us ahead of this webinar. So the 20% of outdoor PM 2.5 coming from household solid fuel use is a pretty big contributor. So let's not ignore it as we think about solutions towards clean air. I've been talking for the last several minutes to you about the burden of disease is really high. It's changing over time, but what do we really mean by burden of disease? It's a phrase that you may have come across both in the State of Global Air reports, but also elsewhere. And essentially, the concept behind it is to calculate the sum total of the impact on health that may come from a number of different factors. So imagine a person born and living a healthy life. We know what the average life expectancy is for people in countries around the world. They live through that life healthily with no diseases and then, die of natural causes at some point. But as we start to think about these various risk factors, including air pollution, but also the other risk factors we can think of, diet, smoking, high blood pressure, malnutrition, other various other risk factors, they can start to impede the quality of life. So a person may be living for several years with a chronic disease, for instance, and they may not be able to work, they may not be able to live with the same quality of life that you would expect a healthy person to live. And that's how we categorize or qualify the years lived with disability. So essentially, you are not able to live to the fullest extent. Your quality of life is not to the fullest extent. And in some cases, these various risk factors, including air pollution, may result in early death or premature death of a person. And that means that we've lost those years that this person would have led a healthy life. So when we combine these different data points, we get what is called DALY, or disability adjusted life years. So it's essentially telling us how much time are we losing from a person's healthy years of life as a result of them either living with a disease or a disability or because they died prematurely, which is why also in the State of Global Air report, you will notice the phrase healthy years of life lost, which essentially represents DALYs. And imagine now, in cases where newborns are dying within the first month of life, we are essentially losing an entire lifetime of someone who would be, living, contributing, like being productive, and compound that with how many deaths we see around the world. The other important question that often comes up is, how are you coming up with these numbers if we don't have the necessary data in all countries around the world? So let me quickly walk you through that. There's essentially three important data points that we need in order to estimate the burden of disease. One is, what kind of pollution are we getting exposed to? And in case of State of Global Air or the global burden of disease, which is the underlying data set that we report on, we look at three major pollutants, PM 2.5 or fine particulate matter, nitrogen dioxide, and ozone. And the exposures for the populations around the world are estimated by combining ground measurements that may be taking place in countries using reference grade air quality monitors. We pull data from the World Health Organization's ambient air quality database from websites like OpenAQ, which are aggregating information from different places, as well as taking other independent data sources, but reference grade air quality monitoring data. At this time, low cost sensor data are not included in the calculations of these exposures. and then combining them with satellite observations and atmospheric models to produce globally consistent estimates of what exposures look like. The second piece of information we look at is how does this exposure to air pollution relate to health effects? And as I said earlier, there has been decades now of studies that look at how does exposure to air pollution impact cardiovascular health outcomes or respiratory health outcomes or dementia or lower respiratory infections. And all that information is synthesized to essentially understand what is the relative risk of exposure to a certain level of an air pollutant, and how does that result in an increased risk for heart disease or increased risk for lung cancer. And over time, we have been adding new data points and new health outcomes. This year, dementia has been added for the first time. Hopefully, we will continue to broaden this series of health outcomes that we estimate the health effects for. And then finally, we want to look at what is an optimal level of exposure that we can reasonably expect a person would have. So when we combine all this, and I'm really, giving this to you in a very simplified way, but by combining these different pieces of information, what is somebody getting exposed to? What is the relative risk of that exposure? And then using national statistics on what is the mortality rate, what are the morbidity rates, we can calculate the burden of disease. So if you were thinking about doing this for your location, what would you need? You would need similar things. You would need an estimate of what people are getting exposed to. This could be based on ground monitoring data, or you could use satellite-derived estimates if you don't have access to ground monitoring data at this point. You would need the understanding of the relative risk or the exposure-response relationship. You can use global data for that, including from the GBD, or you can use local data where it is available. In the EU, for instance, the studies from within Europe are used to calculate the burden of disease for different countries around Europe. The other really critical thing we need is population level information. Often this is available through census data, vital statistics, hospitalization rates, etc., because we really want to understand at the national level what are the trends in health statistics. So in conclusion, just go away from this webinar with a few things in mind. Let them be this. One, that air pollution really impacts most organ systems in human body. It is not just our lungs that are getting impacted or affected. It really is all organ systems. And because of this, air pollution is a very significant risk factor for deaths around the world. And a big number of these deaths are happening as a result of outdoor exposure. But as I said earlier, household air pollution is still a big problem, especially in Africa and in parts of Asia. A significant proportion of air pollution deaths are coming from non-communicable diseases. So we really need to also be thinking about not just air quality interventions, but what are the health sector interventions that can help us address this problem. The data that we have presented today and that are presented in the report and in the data app are all what we have as the best available estimates today based on the scientific evidence, but also the types of health data and exposure data and air quality data that is available. What we really need to do a better job on collectively is to strengthen the health data, local health data, especially in low and middle income countries, and also continue to expand air quality monitoring, especially for pollutants like ozone, where we have very, very limited ground monitoring information. Finally, the largest health impacts are seen in low and middle income countries. We have these huge disparities, and also the biggest impacts are in children and in older adults. This work has really been a team effort across institutions and organizations. So I just want to acknowledge and thank everybody who has been a part of this work, from the Health Effects Institute, from the Institute for Health Metrics and Evaluation, from NCD Alliance, as well as our various other collaborators. And a big thank you also to the Clean Air Fund, who have been supporting the State of Global Air initiative for the last few years. And that makes us, that makes it possible for us to produce this report. And finally, let me leave you today with this general message, which is A lot of these numbers can be alarming and sound very scary, but what we know, and hopefully you can see this in more detail in the report, is that any actions we can take to improve air quality can bring significant health benefits. We now have evidence from multiple countries around the world, from various cities around the world, that if we take action to improve air quality, it does result in health benefits. It does result in healthcare savings and better quality of life. So hopefully the data can also be a reference point as you think about what actions are necessary for your city, your country, and your region. I will stop there and encourage you to also stay in touch with us. If you have questions, please continue to post them in the Q&A function and we'll get to them. But now, let me welcome our first guest, Dr. Maria Neira. I'm really excited that she was able to join us. I think she needs no introduction to this audience. Until recently, she was the director of the Environment and Climate team at WHO. And I think for most of us, she has been the biggest champion for the need for clean air action. So Maria, welcome. And I think what I would ask you about is, I'm sure these numbers are not a surprise to you, but the numbers are just the beginning. Where do we really go from here? What kind of actions do we want to take? And how do we really make progress towards the goal of clean air for all?
Thank you. Thank you very much, Pallavi. Thank you, the Institute, for inviting me and for giving me this opportunity. I'm in Madrid at the moment, just today, and these figures of the number of deaths will represent killing half of the population of Madrid every year. I think this visualizing that an entire city or half of the city disappearing every year due to the effects of air pollution is something that really needs to shock us. Unfortunately, more we repeat this data, more we advance on scientific evidence, the reports that are so strong and so appealing like this one, we still need to do a lot of advocacy, and it looks like many people is not yet aware, or they don't want to be aware, or we need to put more pressure on all of them to make sure that we have action. And this is on what I would like to concentrate now, if you allow me. What is the action? And I think I will call it the strategy now, the no excuses. No excuses. We have very solid data. We can go as deep as we want on analyzing the reasons for this and providing even solutions. And this is the part that where we need to concentrate right now. With this terrible, dramatic evidence that we are presenting today, with these very strong linkages with the non-communicable diseases, and I know that Rachel will talk about that later on, but how can we escape the response to this? How can we not be at the level of ambition and response that this type of public health massive challenge represent? So where is the action? The action comes from keeping with the advocacy. I'm afraid we still need to repeat and repeat and repeat all of this data that you have presented so eloquently. We need to keep going, and we need to remind everyone that the World Health Organization has the clean air guidelines that everybody should adopt or try to reach it, and making sure that by doing so, we will protect the life of the people. So endorsing the air quality guidelines, we need legislation. Probably we need to be more aggressive on the type of legislation and imposing some standards promoted by the air quality guidelines of WHO by law, by reaching some standards that will be protecting the health of our people. In May this year, we have at the World Health Organization, the World Health Assembly, where ministers of health from all the countries around the world, on a very consensus, no controversy, they endorsed the roadmap for fighting air pollution. So I think that the data is there, the scientific evidence, the political commitment through this roadmap, the data that is published very often. So now we need to implement that roadmap. The issue of access to clean sources of energy is fundamental. The public health community cannot be outside the debate and the controversy and the societal decisions that we need to take now in order to promote the transition to cleaner sources of energy. It's our business, it's the public health community business to make sure that we transition from combustion of fossil fuels to something different. And it's our business as well to promote urban health, to work more and more with mayors, with the municipal authorities. Those are the ones that can put in place the multi-sectorial actions that are needed to reduce air pollution. And of course, we need to take care as well of those who are using polluting sources of energy to heat or lighting or cooking in their own, the household level. This transition at the household level is fundamental, particularly for many countries around the world. No way to have a Congress from now on cardiology, on pediatric issues, on the respiratory societies that will not include an issue, a keynote, or something very high on their agenda about air pollution. We need to put pressure as well on what are the health benefits obtained from reducing this dramatic number, that we need to keep repeating the dramatic number, but we need as well to tell people how many lives we can save, how many diseases we can prevent if we put in place all of those interventions. The role of mayors, as I say, is fundamental, but as well the role of governments. They need political courage. We have certain mayors around the world, certain governments that are taking very, at the beginning, maybe unpopular measures, but measures that then result on reducing the air pollution and promoting the health of the people. So the health community, we need to be there to quantify those health benefits that are obtained by each maybe unpopular measures that the local municipalities or governments are putting in place to reduce air pollution. And of course, we need to make sure that we are part of this transformation and make sure that nobody will say, oh, I didn't know, as an excuse. Nobody can say that any longer. Maybe our citizens, but not our politicians, not our responsibles, not our ministers of health who signed the roadmap. So it's now a question of putting pressure, using as well the climate change negotiation at COP to make sure that everybody understands that climate change and air pollution are very much overlapping and linked because their causes are very much overlapping, and therefore this transition to clean sources of energy is fundamental. I think the moment the citizens understand the connection between air pollution and their health, that movement will be irreversible, hopefully very massive and very, very strong. And I really hope that this roadmap that was approved at the World Health Assembly this year will be implemented. My last point is that this year as well, we have the opportunity to organize the second global conference on air pollution and health. And of course, the institute, I mean, the HEI, it's always difficult for me, those three acronyms, each HEI, the Health Effects Institute was present and of course very much partner and as well as the Clean Air Fund. I think it's fundamental to remember that at that global conference on air pollution and health, we focus it very much on interventions that works, on initiatives that we know that they already produce results. So again, no excuses. Action can be taken, and it's our moral, ethical responsibility for the economy of the country as well, and the health of the people. So we need to do much more on tackling the causes of air pollution, on financing interventions to tackle the causes of air pollution, and implementing even by law the standards and the recommendations for doing so.
Thank you so much, Maria, for those very, very clear action points for us. And I think I agree, especially with the point you were making about the second global conference. Even in the 6 years or so that it took from the first conference the WHO did to the second one, I think it was very evident the way that the conversation has changed and evolved. We weren't just convincing people that air pollution is an issue, but actively talking about intervention, what needs to happen, how do we make it happen? And if that's what we are, have managed to achieve as the global community in about 6-7 years, I think there is hope that we can do a lot more in the next coming years. I also forgot to mention that Maria also serves as a commissioner, one of the commissioners for Our Common Air. That's also an excellent place where you can find resources if you're thinking about what needs to happen and what arguments and evidence and information we can use. So I encourage you to check out the website. Next, I would like to invite Rachel Stanton from the NCD Alliance. She's the Policy and Advocacy Officer and has been leading work on air pollution at the Alliance. Prior to coming to the NCD Alliance, she worked at UNDP Global Health and Development Team. She has a keen interest in health inequalities and has worked with a range of stakeholders around the world. So I'm very keen to hear from you, Rachel. This year's report focused on non-communicable disease. And, we see these really stark numbers, like 9 out of 10 air pollution deaths being attributed to non-communicable diseases, more than 500,000 dementia deaths, which is a new number that we have now available. What do you think is the process now to think about integrating air pollution into NCD prevention and control? And also, often we tend to stick with these numbers, but I'm hoping you can shine some light on some of the perhaps not very tangible impacts that NCDs can have on people that live with them. And we haven't accounted for all of those here, but it would be helpful to talk through what it means to be navigating your daily life with living with an NCD and living in a place with high air pollution. And then hopefully you can also touch a little bit on the fourth UN meeting, high-level meeting that happened recently. There were some interesting conversations around air pollution. And really, as I asked Maria, we have these numbers, they're big, they're stark. Where do we go from here?
Thanks so much, Pallavi, and thanks so much for the opportunity to contribute to the report and also the webinar today. Yeah, certainly. So we have this data about the impact of air pollution, with 9 out of 10 air pollution deaths being NCDs. And the data in the report really make the case for making sure that air pollution is integrated in NCD prevention and control plans. But I'd say, unfortunately, the progress in this has been quite slow globally. And there are certainly several steps that countries can take to address this. One being to accelerate action on air pollution through some of the ways that Maria mentioned, so developing and taking action to meet the standards set by WHO guidelines, and implementing clean air interventions to meet those commitments that have been made in the WHO roadmap and also the political declaration under the high-level meeting, which I'll move on to a little bit later. Second, to mobilize investment for air quality and ensure more coherent fiscal policies. This has to include phasing out subsidies on all fossil fuels. So the new Lancet Countdown on Health and Climate Change, which was recently published, showed that $956 billion was spent on subsidies for fossil fuels in 2023. And actually 15 countries spent more on subsidizing fossil fuels than they did on their entire health budget. And I think if we're serious about tackling the really growing burden of NCDs and indeed air pollution, we have to shift this investment towards health promotion and also ensuring that we're supporting a just transition away from fossil fuels. And then finally, I think, in terms of including air pollution as part of NCD programs, it's really key that we make sure that we meaningfully engage communities that are most affected by air pollution, including those with lived experience of NCDs, and that these are included in social participation mechanisms, making sure that they're at the heart of decision making. At the same time, we have to make sure that these decision-making processes are protected against industry interference from vested interests, including the fossil fuel industry. While there's definitely differences, there's a lot of similarities between the tactics used by tobacco industries and other big industries for NCDs and what we're seeing by the fossil fuel industry. And whilst there's a lot of while there's a lot of differences, the fact that there's a lot of similarities mean that there's a lot of opportunities to learn lessons for solutions here. You mentioned the broader impacts apart from mortality and morbidity. And I think there's a couple of important points here. First, that the impact is still likely to be underestimated. So, we're super pleased to see the data on dementia included for the first time this year, but there's definitely many conditions that are still not captured. So there's a lot of new research constantly emerging on the links between air pollution and poor outcomes for mental health, for instance, and the data on cancer, air pollution related cancer at the moment only includes lung cancer. So I think, in terms of when we're talking about the figures, it's important to also remember that there's still a lot of impacts on NCDs that aren't fully captured by the data there. And certainly, yeah, the conversations that focus on the data also miss out on the other impacts, especially for people living with NCDs. So we know that air pollution does affect everyone, but particularly for people living with NCDs, they are uniquely vulnerable. So it can exacerbate the frequency and severity of symptoms for people already living with an NCD. So especially things like respiratory conditions. So during episodes of high air pollution, this may impact the kind of activities that they can do or want to do because of this impact that it has. Similarly, for people with cancer, it can worsen symptoms, increase treatment complications, and we know it's also associated with worse outcomes. There's also the economic impact that isn't necessarily captured there, both at the individual, community, and national level. So people missing time out from or dropping out completely of education or work due to ill health, whether that's from themselves or caring for a family member that may have ill health or an NCD from air pollution, as well as out-of-pocket payments where the cost of treating the condition isn't fully covered by the government or insurance schemes, as well as the economic burden at the national level for screening, managing, and treating these conditions. And then also the impact that it has on equality. So as I mentioned, we know that air pollution affects everyone, but there are definitely these certain groups with unique vulnerabilities. And, beyond people with NCD specifically, we know that women and girls are most impacted by household air pollution in lower middle income countries. And as well as those living with NCDs, those with low incomes, young people, and people with limited access to healthcare are most susceptible to the health impacts of air pollution. So there's definitely this element of exacerbating inequalities, which is not necessarily captured in that discussion either. And then, finally coming to the fourth UN high-level meeting on NCDs and mental health. This took place last month in the 25th of September in New York. And the resulting declaration, the political declaration, is currently awaiting approval from the General Assembly, but it did receive broad support from member states at the high-level meeting. I think specifically for air pollution, we welcome the recognition of air pollution in the text. It's sort of built on its recognition and the shift from the 4x4 to 5x5 approach that happened in the last high-level meeting in 2018. And it does include a number of commitments on air pollution, which is really great to see. These include promoting clean and expanded urban public transport and active mobility, as well as promoting access to clean and less polluting solutions for cooking, heating, and electricity generation. However, it does fall short in several key areas. It fails to explicitly address fossil fuels as a primary driver, both of air pollution and climate change. It doesn't include commitments to promote national air quality standards. And there also isn't anything there on greater integration of climate concerns into health system strengthening and resilience efforts, which are all things that we really would have liked to see in there. I think it's important when thinking about the political declaration specifically to see it more as the floor and not the ceiling. Although it was good to see that during the HLM, the high-level meeting itself, governments did demonstrate that in their individual capacity, they are ready to tackle these issues. The other thing worth noting around this is that we have seen countries and cities, like Maria mentioned, already making great progress in implementing a number of measures to do with air pollution, including those that relate to the commitments made. So I think here there are, fortunately, lots of lessons learned and best practices that we can already point to for other countries that are now hopefully going to implement measures to meet these commitments, and that these can be used to help advocate for exactly that. And then finally, just in the light of this, I think it's also a really important time to reiterate WHO's mandate to produce a menu of cost-effective best buys for policy interventions on air pollution. as it's the only major NCD risk factor without these. And I'll pause there and thank you again, Pallavi, for the opportunity to contribute to this.
Thank you very much, Rachel. I really appreciate that both you and Maria, highlighted the windows of opportunity, because I think that is critical. If we look back at just the last 2 years, the fact that at the global scale, we had consensus around a UNEA resolution on air quality that called for more regional cooperation, more data and better coordination, the WHO roadmap that Maria mentioned, and now indeed, acknowledging air pollution as an important risk factor. There seems to be more momentum towards the need for cleaner action, and hopefully the variety of activities that are happening in different places, some of which are also highlighted in the report, can give us good examples to build further action on. Rachel, if I request you to maybe address one thing. In your remarks, you talked about the 4x4 approach versus the 5x5 approach. I know what you're talking about, but I think not everyone here may know about it. So can you please tell us a little bit about what the 4x4 was and what the 5x5 is, and why we care about that?
Sorry, I forgot to unmute. Yeah, certainly. So in the last political declaration, which took place in 2018, there was 4 risk factors recognized, as well as 4 core NCDs, non-communicable diseases. And one of the big shifts that we saw in the 2018 political declaration was a shift from that to the 5x5. So it added mental health as the 5th non-communicable disease, and then also added air pollution as the risk factor. Whereas previously it was focused on tobacco control, alcohol, unhealthy diet, and physical inactivity. So yeah, it was first recognized in the 2018 political declaration, and the one that took place last month really builds on that by bringing more focus on air pollution and the commitments that I mentioned.
Fantastic. Thank you so much. Maria, there's a question here that I think you're uniquely positioned to answer. So we have someone from Africa, a toxicologist, who is acknowledging that there are communities that face a lot of skepticism and also constraints in terms of resources that they may have access to. And what are some practical ways that people can talk about recommendation of the WHO air quality guidelines, starting with the interim targets, which of course are a lot more realistic, and also think about risk communication, what kind of partnerships, what kind of collaborations do we need to use in order to build trust and move the needle on action. So if I can request you to please share your thoughts on this.
Yeah, thank you for the question. It's true that it's an argument that is often used. We have other priorities on public health. We have diseases that we need to tackle. So we don't have the resources to take care of the causes of air pollution. And my answer is that, well, this is a public health issue. This is like a big disease, but maybe very invisible because you cannot touch it, or you don't quantify how many cases of malaria in the same way that you will qualify how many diseases and deaths you have caused by air pollution. But this is a very much for the health professionals as well to take care. The resources for tackling air pollution doesn't need to come from the health system. They need to come from other sources, the transport, the energy, the government, the presidency of the government, and the Ministry of Economy as well, because this is very much tackling the causes means addressing the issue of access to clean sources of energy and deciding which sources of energy a country will decide to move on it, the public transport system that you are going to have, the way you will be investing on designing your cities and create a more sustainable, the legislation that you are putting in place, and all of those interventions. However, the role of the health professions will be very much to use your voice on those countries with limited sources of limited resources, to use your voice to say, look at the number of cases we have of non-communicable diseases, which are very costly to address because they are chronic diseases and our hospitals are already paying the price. my last point is that, you know, at the global conference on air pollution and health in Cartagena this year in March, one of the most beautiful slides that we were all was presented was the one by the Vice Minister of Health from China, where he showed us, you remember that, I'm sure, he showed us how air pollution was going down in the most important cities in China, the ones where they have business, a lot of business. So air pollution is going down while the GDP of the country is going up. So I think this is something to reflect about. It. It's not about using the resources for other or prioritizing or not selecting the right priorities. It's very much about as well understanding that it's a health issue and the funds needs to come from foundations, private industry, all of those who are polluting as well, they should pay.
Fantastic. Thank you so much, so very much, Maria. And I think that this is so true, that example from China of the decoupling between increasing development, but at the same time, reductions in air pollution is a really, really good data point for us, all of us, to keep in mind. Rachel, we have a question here, which I can start off with, but would love to also get your thoughts on, which is around, the fact that perhaps we need to be disseminating some of the data which are closer to people. So thinking about lung function impairment, thinking about more immediate symptoms that can happen. And I think the question was addressed to Maria, so I'll also give Maria a chance to respond to this if she would like. But we have heard this a lot of times before, numbers like these, even though they're big and stark, are not always as compelling, because I don't know, as a regular person going about my life, what do I do with this information? You're telling me that millions of people are dying because of air pollution, but I don't necessarily know someone that has died because of air pollution. And I have been in Delhi for the last several weeks. It's been hazy. Air pollution levels have been going up and down. And I've met dozens of people who are talking about the fact that they're experiencing respiratory symptoms, or when they're outdoors, their eyes are itching, they don't want to be spending a lot of time outside, or they're coughing a lot. And that has been a really useful connector to talk to them about how air pollution can impact their health. And I wonder, Rachel, in your experience, what would you say to that? And also, are there types of metrics or data points that people tend to react to better, and how do we think about them? And then Maria, after Rachel, if you would also like to respond to that question, welcome your feedback.
Yeah, thanks, Pallavi. I think there's a couple of different sides to it here. I think, yeah, certainly we need better communication about it in general. I think there is a knowledge information gap, especially at the population level, about understanding the impact that air pollution has on our health and at what level, just more broadly. I think the second part of that is that, the health system or health professionals in countries need to, where they can, do a better job of informing people when there is a spike in air pollution, so that people can be aware of the impact it can have on their health, especially for people living with existing conditions like NCDs, so they can make better informed decisions when they have that choice to, at least. And then, yeah, I think on the point about more persuasive data, I think that's part of the reason why having real meaningful engagement of people most affected by air pollution is so important. I think, yes, definitely having this data is so important, and the figures are so stark, and certainly we hope that they're persuasive. But I think there is also the element of, we also have to remember that behind each data point is a real person. And I think also that communication that really captures that, and sharing stories, especially of those people living with NCDs, especially the ones that are attributable to air pollution, is really important and can help us have better conversations about that, and hopefully also be a useful tool to advocate for stronger action on air pollution as well.
Yeah, thank you. Maria.
Yeah, thank you very much. And before I was showing you that I'm at the Congress of the Deputies in Spain, because they are, and I think this is important, they are negotiating a state pact on climate change. And obviously, I put it very much inside that, at the beginning of that, the issue of air pollution and how many deaths are caused by exposure to air pollution, because this is maybe one of the big motivation to do more on climate change using the data that was presented here today. Data is, of course, fundamental. Without the data, we are not able to demonstrate anything. However, it's true as well that putting the data on the table, even if it's absolutely dramatic and so huge and challenging as the one we are presenting here today, doesn't mean that immediately will provoke action, reaction, particularly at the level of the magnitude of the problem we are addressing here. We have the sample of tobacco. We knew about tobacco causing damage to our health for the first time when evidence started to be generated. It took 50 years until the Framework Convention on Tobacco was negotiated. My point is, it's absolutely unacceptable to do the same for air pollution. No way. And there are many differences between air pollution and tobacco. Of course, tobacco is one industry, I will say one target for us, and it's very much somehow behavioral and, of course, caused by the environment. But air pollution requires a very multidisciplinary, multisectorial, but it's all about how our societies are evolving. So honestly, we need to use the data on a very smart and strategic and tactic way, because the data alone will not be enough to provoke the action we want. So we need to link the data to interventions, to positive, to convincing, infiltrating in different environments, and be very, very much politicians, in the good sense of the word politician, doing public health politics, which means that our voice that as the health professionals needs to be very, very at the high level. And that's why I was so pleased to be here at the Congress on a hearing as a health professional on something that normally will be considered as a political issue discussed by governments or presidents or prime ministers or industry professionals. And health has been the first intervention, because after all, health is the one that will motivate the most. So don't give up, keep pushing. This is so important. Each of us, we can do our little contribution to this, but we need to be very ambitious and accelerate, because the speed at the moment is very frustrating.
Thank you so much, Maria. And it's really great that you're consistently also urging healthcare professionals to really be front and center of this conversation. Also, because a lot of us trust our doctors. We do what our doctors tell us to do, and they can be really powerful messengers for the need for clean air action and the various interventions that need to happen. One of the other questions, which I think connects to some of this, coming in from the co-chair of the Citizen Science Global Partnership Air Quality Group. Fantastic to have you here. Is that, what is the role and contribution of citizen science for clean air? And I think I'm going to just say here that in the last decade, the role that citizen science and different projects and interventions that even individuals have undertaken in many cities around the world have been truly transformational, both in getting air pollution on the map, getting people to think about air pollution. Think a couple of examples I would like to give here. One is from Pakistan, where a single person decided to put up a few low-cost sensors and started transmitting that data on social media. Eventually, that gained the attention of a lot of people, resulted in the court in the country taking notice and really instructing the government to take action to reduce air pollution. That work has since expanded into many other things, but where it started was one citizen installing sensors, starting to gather and transmit air quality information. Similarly, in Central Asia, we've seen a couple of different examples where citizen groups have really rallied to install air quality monitors, start to collect that information, and then use that information in a very productive way to work with the government to identify interventions, to identify where the hotspots are, and therefore where immediate attention needs to be paid. So citizen science has a huge role to play. Even in Africa, there's a really interesting, very powerful example of youth using citizen science as a way to engage people around air pollution. The group is called Urban Better. I really encourage you to check them out. And it's really young people using low-cost sensing technologies to organize runs and walks around the cities to get people to talk about air pollution, to understand what different levels of air pollution may be in different places, and to get them to then get involved in demanding action or taking action at a more individual level. So I think citizen science has already been a really critical part of moving this conversation forward. And hopefully we will continue to see many, many more relevant collaborations in that space. So thank you very much for that question. I will try and quickly answer a couple of more technical questions that have also come in. One around dementia. So how does dementia cause death? I'll give you a 2-minute version of this and maybe invite Maria to also add to it if she would like. And essentially, when we are breathing in polluted air, that pollution, especially the particles, are going into our often going into our bloodstream and can also cross the blood-brain barrier. And if they cross the blood-brain barrier, they can essentially trigger inflammation in nerve tissue, which over time can then result in diseases like dementia developing. In the report, we talk about the mechanism in a little bit more detail, so I encourage you to check that out. There's growing evidence around how exposure to air pollution is linked to dementia, Alzheimer's, but also vascular dementia and other forms of dementia. And you also noticed, you asked this question of, is the upward trend really a result of better reporting and not necessarily actual incidence increasing? And of course, in a lot of cases for diseases over time, as reporting gets better, as the quality of data gets better, we see improvements in how we can estimate what the number of deaths may be. But when we present these overall estimates, we do take into account any differences that may be happening as a result of changes in the type and the quality of data that is available. So this increase is not necessarily attributable to the fact that there is better reporting, although better reporting is always going to help us get more specific estimates. And I will couple this with another question from Heather Khwaja, who is asking about the availability of data, essentially hospital data, which can be very hard to get. I also alluded to this earlier, that indeed the access to health data continues to be a major barrier, even if you're trying to estimate health impacts and do essentially observational studies trying to look at how trends are changing over time. Getting access to clean and ready to use hospital data can be a difficult challenge. There's several researchers who've spent maybe a year or more trying to gather and clean data that is available from the hospitals. Partly it is because we don't have the right infrastructure, partly it's because doctors are really overburdened in many LMICs, and they're seeing upwards of 100, 200, 400 patients every single day. So they're not necessarily taking all the data points that we will need to do an air quality and health study. It is an issue. I think there are starting to be some really good interventions to try and improve the availability of data. Vital Strategies, for example, has an excellent program that is trying to build health data capacity. The World Health Organization, of course, for years has been working with countries on this issue as well. And it is a challenge, and there is no easy solution to this, but hopefully we can begin to move the needle forward by looking for relevant partners. A third question, actually, before I go to that, Maria, is there anything that you would like to add on the dementia and air pollution piece? I know you have a fantastic TED Talk on air pollution and brain health, which we'll also put in the chat here.
Yeah, thank you very much. Yes, I think it's very important to start to talk more and more about the impact of air pollution on our brain. And of course, dementia, this data that you presented today is fundamental. But I think the society might understand a little bit the linkage between air pollution and respiratory diseases. But when you talk about impact in our brain, they are very, very much they are not aware. So we need to do a double effort. So that's why this data presented today is very important to involve as well other associations, people working on brain's health, which until now they have been a little bit separate from our discussion, but this is becoming a very, very important issue. It's water.
Fantastic. I think we are coming close now to the end of the webinar here. I know we still have a number of comments and questions here, so hopefully you will join us in one of our future regional briefings where we will continue to talk about this. But before we come to a close, Maria, any final thoughts for our group here?
Yeah, I think my final thought is that my final point is that we cannot escape our huge responsibility as a public health officials or as health professionals. Data is very strong, but it's our responsibility as well to use as much as possible the data for accelerating action and for changing the situation, and definitely be the drivers, the ones that will be driving this huge transformation that our society need. And this transformation will not only be good for health, but good for the economy and for the sustainability of our world. So we have a huge responsibility and we need to go for it. This cannot be another tobacco, taking 50 years to mobilize action and reaching maybe even a treaty. I would love to see an air pollution treaty similar to the one on tobacco, imposing standards in all the countries by legislation. But this is just a dream. I want to dream.
Fantastic. Rachel, any final thoughts from you?
Thanks, Pallavi. Yeah, so I know someone in the chat mentioned about tobacco, and I think that's a really great example of the importance of integrating air pollution and NCD policies and really optimizing the benefits. So we do talk a little bit about the air pollution aspect of tobacco. We know that secondhand smoking deaths cause more than 1 million deaths a year, and a lot of those are children. And I think that is one of the great examples where, you know, reducing tobacco prevalence can also reduce the impact of air pollution. And there's so many examples of these, like increasing public transport and active transport can reduce air pollution while also reducing other NCD risk factors by encouraging physical activity and so on. You know, it's a very interconnected problem, and I think it really needs an integrated solution. And by pursuing these countries can really tackle the huge burden that's growing even more.
I think that is a really fantastic point. And I really appreciate a comment that just came in as we were closing this from Rich Castle, who, you know, highlighted essentially something that I've also experienced. If we talk about people that have died as a result of air pollution, you're not going to really see any hands go up. And globally today, we really only have one case, you know, the unfortunate case of Ella, who died due to severe asthma, and the death was attributed to air pollution. A really powerful story, but it is one story. But if you start to ask people, you know, do you have family members with asthma, with hypertension, with heart disease? People start to think about, oh, yes, I do. And that can be a good connection point. So I think where I would like to close today is, we've produced this report. There's lots of rich data and information in it, but this data and information can only go as far as we all collectively can take this data and information and push for action, think about interventions that are relevant. As you also heard from our panelists here, there's lots of interventions and examples that are out there that we know about, and we know how to really get to clean air. So hopefully this is the start of the conversation. We will also be doing regional briefings where we will dive into data for specific countries. And if you are interested in a particular country, in a particular region, or a particular endpoint, please get in touch with us by email. We'll be happy to talk more with you. And thank you very, very much for being here today and for engaging with State of Global Air. With that, we'll close for today and we'll see you next time. Thank you.